Pulmonary hypertension. What is it? Pulmonary hypertension, PH, is a rare and serious condition characterized by elevated pressure in the pulmonary arteries. This leads to a deterioration of lung and heart function, which can result in significant limitations in the patient's daily life. The difference between pulmonary hypertension and arterial hypertension. Pulmonary hypertension, PH, and arterial hypertension, AR, are two distinct conditions, although both are associated with increased pressure in the blood vessels. As mentioned above, pulmonary hypertension, PH, is a condition in which there is increased pressure in the pulmonary arteries. PH can be caused by various factors such as chronic pulmonary diseases, heart function disorders, or genetic factors. In patients with pulmonary hypertension, PH, increased pressure in the pulmonary arteries creates an additional burden on the right ventricle of the heart, which can lead to its dysfunction. Arterial hypertension, AR, or high blood pressure, is a condition in which the pressure in the arteries is elevated. AR can be caused by various factors, including genetics, aging, obesity, poor nutrition, physical inactivity, and stress. Elevated blood pressure can lead to various complications, such as myocardial infarction, stroke, and kidney disease. Thus, the main difference between pulmonary hypertension and arterial hypertension is that the former is associated with increased pressure in the pulmonary arteries, while the latter is associated with increased pressure in the arteries throughout the body. Pulmonary hypertension can be classified as primary or secondary. Primary PH, also known as idiopathic pulmonary hypertension, IPH, occurs without an apparent cause and is a hereditary condition. Secondary PH occurs as a result of other diseases, such as chronic obstructive pulmonary disease, pulmonary fibrosis, arterial hypertension, and others. Clinical manifestations of pulmonary hypertension may include shortness of breath, fatigue, dizziness, fainting, chest pain, and swelling of the legs and abdomen. Patients with pulmonary hypertension often experience limitations in physical activity and a decline in quality of life. It is important to seek medical attention if pulmonary hypertension is suspected, as this condition progresses over time and can lead to serious complications. Physicians specializing in pulmonary hypertension can conduct diagnostic tests such as echocardiography, computed tomography, or heart catheterization to confirm the diagnosis and determine the severity of the condition. Treatment for pulmonary hypertension may include conservative methods such as medication therapy, lifestyle changes, quitting smoking, increasing physical activity, and oxygen therapy. Medications used to treat pulmonary hypertension include vasodilators, anticoagulants, and diuretics. In some cases, when conservative methods do not yield adequate results, surgical intervention may be required. This could involve lung transplantation or surgical procedures to improve blood flow in the pulmonary arteries. So, let's summarize. Pulmonary hypertension is a serious condition that requires medical intervention. Early seeking of help and proper treatment can significantly improve the prognosis and quality of life for the patient.